Hello, I'm Dr. Daniel Murtaugh, and this presentation is to inform you about your vasectomy. I'd like to talk to you about the events of the day. I want to tell you how to take care of yourself afterwards. I want to go over the complications and the follow-up to make sure it's successful. The day of the procedure, you'll come into the other side of the building where we have our operating rooms. Once you're on the operating table, I need to numb up a small area of skin on the scrotum. It's through that area that I actually take a piece of the vas tubing out on either side. I tie each loose end off. I cauterize the openings to seal the lumens closed, and then I sew you up with dissolvable sutures so you don't have to come back to have the sutures removed. The whole thing takes about a half an hour. When you're finished, you'll feel fine because the anesthetic effect will last for a number of hours. It'll give you time to go home, lay down flat, get an ice pack on the area, and start taking some Advil. Then your job for the next 48 hours is to keep the swelling to a minimum with an ice pack and the inflammation to a minimum with ibuprofen. Most people do this on a Thursday or Friday, and they take the weekend, which is devoted to those two concerns. I want to hasten to say that just because it turns Monday does not mean that you're healed and you can do what you want to do. This is a real operation. You have to treat it as such. And so for that next week and the following weekend, there's no strenuous activity, moderately strenuous activity, athletic programs, or exercise programs. That is in an effort to reduce your complications. The complications involved in this are first bleeding. Anytime you do an operation, there's a risk of bleeding. There's a risk of infection. We will be giving you a broad spectrum antibiotic designed to keep your risk of infection as low as we can get it. It doesn't guarantee you won't have an infection, but it will keep your risk low. The complication we see more often than any other is inflammation. And that's where guys get pain on one side or the other side in the absence of a bleed or an infection. The reason that happens is that guys are usually really good about taking care of themselves over the weekend and the first part of the week. They do such a good job that by midweek they do something they don't think is that strenuous, like lift a car seat, a garbage can, mow the lawn, and the next day they wake up with this big, swollen, painful scrotum. And it's right back to the beginning of the healing process. So I'll ask you to use some forethought and some common sense in the healing process. It's 2 months after the procedure that we have you bring your first specimen in. Collect it in a condom, tie the condom in a knot so the liquid doesn't leak out, put it in a container with your name on it, and drop it off at our front desk. It doesn't need to be kept warm or cold. Bring it in a brown paper bag with your name on it, and again the word VAS. We look at those at the end of the day. We call you the following day with the results. If it's negative, meaning no sperm, we have you repeat it the following month, and every month thereafter until we get 2 back-to-back negatives. Once we get 2 back-to-back negatives, that's when we'll give you the go-ahead for unprotected intercourse. But until that time, you need to use protection. We'd also like to have it checked in 6 months and at the end of a year. The reason we go through all those checks is because there's a less than 1% chance that these tubes can grow back together and make you fertile. That can happen. That can happen even if I do a perfect operation and even if you are a perfect post-operative patient. It's happened to me before. I'm sure it'll happen to me again sometime. It happens to everybody who does enough of these. Now the other side of the coin is that I can't guarantee you I can reverse it. So once it's done, you should consider it as permanent. And now I will be in a short period of time to examine you and ask you any questions that you might have. I hope you found this presentation interesting and informative. Thank you.